In a real medical emergency, our biggest enemy is often just panic. But what if you had a simple tool, something you could remember that would just cut right through all that chaos? Well, that's exactly what we're talking about today. We're going to break down the DR's ABC protocol. Think of it as your blueprint for taking control when every single second counts. So let's set the scene. Imagine you're just out, minding your own business, and someone nearby just collapses. Your heart starts pounding, right? Your mind is racing with a million questions, but the biggest one is just, what do I do? In that moment, it's totally natural to freeze up. But that's where having a plan completely changes the game. And the DRACB protocol is exactly that. It's a simple, super memorable acronym that's designed to slice through the panic and just give you a clear, logical set of actions for pretty much any first aid situation you might face. So let's take a quick look at the whole roadmap. It's just 6 simple steps: danger, response, send for help, and then you've got airway, breathing, and circulation. We're going to walk through each one, but you can already see how this takes a totally overwhelming situation and breaks it down into something you can actually manage. Now, it really helps to think about this protocol in 2 parts. The first 3 letters, D, R, and S, these are your absolute first priorities, and they happen before you even lay a hand on the person. It's all about making sure the scene is safe and getting professional help on the way. So first up, D is for danger. Before you go rushing in, you have to stop for just a second and ask, is it actually safe for me to be here? You've got to check out the scene for any threats. We're talking traffic, fire, anything that could be a hazard, and make it safe if you can. And that brings us to the single most important rule in all of first aid: protect yourself first. Seriously, remember this. You can't help anyone if you get hurt too. This isn't about being selfish. It's absolutely essential if you want to help effectively. Okay, once you know the scene is safe, we move on to R, and that's for response. Now you need to find out if the person is conscious. A simple, hello, can you hear me, while you gently tap their shoulder is the standard way to check for response. Now, if you don't get any response, or really, if you're ever uncertain about what to do, this next step is completely non-negotiable. S stands for send for help. Your number 1 priority now is to get the professionals moving in your direction as fast as possible. So you're going to dial your local emergency number. Here it's 113, maybe it's 911 or 999 where you are. The key thing is simple: don't hesitate. If you even think you might need help, just make the call. It is always, always better to be safe than sorry. All right, so help is on the way. Now you can turn your full attention to the patient. And this brings us to the second part of the protocol, ABC. These are the critical, hands-on checks you're going to do for the basic functions of life. A is for airway. You have to ask, is the person's airway open and clear? Because think about it, nothing else you do is going to matter if they can't get air into their lungs. You've got to check that their mouth and throat are free of any blockages. Once you've got a clear airway, we move to B, which is for breathing. Is the person actually breathing normally? This is where you use your senses. Look for their chest rising and falling, listen for the sounds of breathing, and you can even feel for their breath on your cheek. And finally, C is for circulation. Here, you're looking for signs of life. Is there a pulse? Are they maybe coughing or moving on their own? Any of these are really good signs that blood is circulating through their body. So what did we just do here? DR's ABC, it's so much more than just an acronym, isn't it? It's like a mental blueprint that takes that first awful moment of panic and transforms it into a series of purposeful, potentially life-saving actions. The most important thing to take away from all this is that you don't need to be a doctor to make a massive difference. You just need a plan. DRS gets the scene safe and calls in the cavalry. ABC guides you through checking on the patient. It's simple, it's logical, and it is incredibly effective. Look, this knowledge is a really powerful tool. It gives you the structure and, honestly, the confidence to step up and help when it matters the most. So the only real question left is, now that you have the blueprint, are you ready to act?